So today on our channel we have a guest that has been here before. This is my friend Heidi, my childhood friend Heidi. We've known each other since we were young, and since today's topic of the video is more like healthcare and health related, I thought I'm not really that knowledgeable about that sort of thing. I can only speak on behalf of the NHS in Scotland, but Heidi is a nurse right now working in a hospital in Finland, so I thought I would bring her along and maybe she could help fill in whatever questions you guys have left me.
Sure thing.
So one of the first questions, I guess, can be generalized to how did you become a nurse in Finland? Like, what was your path to reaching that point?
Do you mean like
just tell your story.
I don't know, I guess, in high school, because I wasn't sure what I wanted to do, and then I think it was my mom who suggested that I first and foremost find a degree in something that will always get me employed. So yeah, so then I just went to the high school counselor and she helped me look up different options and helped me with the application process. And
what was the application process like?
Basically you do it online, but the school has an interview. Usually there, or at least in my case, there was 2 professors and then me. And then there's the test, the exam, which has a psychological part, and then also math and logical thinking and stuff like that.
And then once you've passed that, you get into the program?
Yeah, you only get accepted into the whole application process if your grades in high school are good enough.
Mm-hmm. And then what was the degree like? It was 3.5 years?
Yeah, so 3.5 years. First year is mostly theoretical stuff, more of the ethical side and things like that, and social skills. Yeah, those are important, but we were practicing those on a very
theory-based?
Yeah.
Not practical?
Yeah, we made plays, and we're showing different situations on what not to do. And I guess those were helpful to some extent. Then, the studies vary based on the school you go to. So I went to the Diakonia Ammattikorkeakoulu, and we have a lot of placements, so clinical practices in different hospitals and places. In the nursing field. Language studies, we have to be, fluent enough in Swedish and English as well.
And then once you finished your degree, then you become a registered nurse in Finland?
Not straight away. You need to be registered by Valvira, Supervisory Authority for Welfare and Health in Finland.
And how did you get authorized by them?
I think you do it through the university. So I went to the student's office.
I come a bit forward.
And they do the application for me. It costs I don't know, 50 euros, I think. And then they send you the letter that you're registered, and you have to take that to job interviews and stuff. And also, I think it works the way that if you type your name in there on the website, it will show
if you're registered?
Yeah, I think at least it used to work like that.
The basis for that registration was your degree?
Yeah.
Okay. So then, if there were some questions regarding if people have a nursing degree abroad, do you have any idea how that would convert here? They would probably have to get that Valvira.
I know some nurses because we have different levels of nursing in Finland. There's lähihoitajat, perushoitajat, sairaanhoitajat. I don't really know how to explain those. In the UK they had registered nurses. Then they had what are they, kind of nurse assistants, mm-hmm. which I guess would be the equivalent of a lähihoitaja in Finland. And nurses who came, for instance, from Asia, who were full registered nurses, they could only work as more of a lower level nurse, a assistant nurse, I guess. over here because their degree isn't considered like of the same value.
So then they might have to go back and like to schooling.
Yeah, I think they have to do, I don't think they have to do the full degree, but they'd have to get some qualifications and yeah.
I see. And then what about your colleagues and stuff? Like what kind of language competence do people have? Like how would you be able to work if you don't know Finnish, or is that like a requirement?
I think it's a requirement. Like you don't have to know Finnish well, but you have to get by. I guess it depends also where you work. If more in like bigger hospitals and stuff, you need to be competent. I mean, we are like we're supposed to, you know, be fluent in Swedish as well, but not many people are, like, can get by, but like I've only once had a Swedish patient and I mean, it was okay. Like yeah, it was okay.
But then you'd have to at least have like a working knowledge of Finnish.
Yeah. Yeah, I've never at least met a nurse in Finland who doesn't know Finnish.
There's more like questions about like how the public health system works in Finland. So like for example, like if you fall sick or like you want to get checked up or something, like how would you go about doing that?
I mean, I think you'd go to your like local health center. So basically, what's like kunta?
County.
Yeah, obviously if it's an emergency, like a really bad emergency, like big emergency, just like go to the emergency department in the hospital.
And does it like differ if you're a Finnish citizen or EU citizen or like someone from abroad living here? Like would the process be the same, you think?
I think it's the same. Yeah, they take you by order.
So just like based on where you live, you go to like the local health service in
yeah.
your area.
Yeah, I think even if you're not a Finnish citizen, you can still go there and they create you this temporary like the social security number.
Mm.
So you'll get service, but like I think you still have to, yeah. I'm not exactly sure how it goes. But everyone gets treated, no one's like
Denied.
yeah.
And then how does like the payment go? Like would you pay each time you go, or like what aspects of the health services are free, or?
I mean, healthcare in Finland is not free, but what I consider it's affordable. Yeah, if you go see a doctor, it costs, but it's not that much. It's less than 20 euros. And the prescriptions also cost.
So I think that's the main difference with like, for example, when I was living in Scotland with the NHS, like everything was free there. Like your doctor's visits were free, your prescriptions were free, like all your medicines were free. Whereas here, I think you go and you pay like a minimum fee, but it's not like a lot.
Yeah, and I mean it like comes to you in the bill comes to you in the mail. You don't have to start paying there and then. But I think healthcare it's free for under 18-year-olds.
Yeah, like dental.
Yeah,
costs
even dental.
Are free
Yeah.
for under 18.
And for instance, birth control pills are, I think, it depends also on the county, but they're free for like under 18-year-olds.
And then would this be considered also like for EU citizens the same, or like for example, what if you had like a citizenship abroad, would it then the price be different?
If you are a member of the European Union, I think it's the same price. Like you have the European sickness insurance card. So for instance, because I live in Portugal now, I have this card, and if I need to seek like public medical care, I get it for the same price as I think the local people in Portugal.
And then if you came here and you were like a foreign citizen, like a citizen of another country, but you had the residence permit, do you have any idea how that would fall under?
I think it's the same. Residence. Yeah, I think you're still. That's like oleskelulupa, isn't it? Yeah, you have the same rights, I think.
Yeah,
Healthcare.
I think because my mom had the residence permit. I think for her it was the same as it was for a Finnish citizen. Yeah, so I was asking about like universities. If you come to Finland to study at a university,
Universities usually have their own nurses at least, so you can get like vaccinations and stuff like that through that, but I'm not sure about like other medical aid.
And then what's like the difference between the public healthcare here and the private?
I mean, I haven't really ever used private healthcare. I mean, it's more the private one is more expensive, but they have very short waiting hours. You get treated, you know, like a lot faster, and some people say that they prefer private because it's better quality.
I think the only time I went to private was when I had to get like a tuberculosis x-ray for my visa in Singapore, and it was like I was leaving like in a couple days and I had to get it like ASAP. So then we went to private to do that, but otherwise I think I've always gone to public.
But I have a lot of friends who they work in the like in the nursing field in Finland, in, you know, public hospitals, but they still, if something happens to them, they go to private healthcare.
What's their reasoning?
It's faster and yeah.
Yeah, I guess in the public, like you should usually go like right when it opens, because like the waiting time gets quite ridiculous sometimes.
Or if it's like the emergency department in the hospital, if you go in the middle of the night, it's usually quite empty.
So what times would you like recommend going, or what days of the week?
Gosh. Mondays I think are Mondays in the health center are really busy.
I guess most people usually wait till after the weekend. Okay, and then someone was asking what the reason was for there not to be 24-hour emergency service in small Finnish cities. And why? Because they thought it was quite risky. My comment on this right away was just, I think most small cities all around the world don't have like emergency services.
I mean, in an ideal society, like, we have this available for everyone, but like it's not possible. And I think now they're like, with the new healthcare policies, they're trying to like decrease that even more. I think it's a risk you take if you don't live near, you know, big cities, and I mean if you live further away from like
Or a metropolis area.
Yeah, you lose a lot of services, including health services. So I think it's a choice everyone makes.
And they have like the helicopter emergency services and stuff, but I mean, I guess it's just if maybe it like costs a lot to like run those services compared to like the amount of people that would use them.
A lot of like smaller towns have lost their health centers and hospitals the past few years. And yeah, it sucks for the people who live in those places. But
this person was wanting like a lot of translations, so they were wanting to know like how you would write a medical bracelet info so it's understood in Finnish, and they were like concerned about traveling to Finland because they had a lot of medical issues, and then like wanting to be able to communicate if they need to see a doctor or get an ambulance and stuff. So what would you suggest to them?
I mean, everyone at least, I mean, they do, or at least they should know English, like in the healthcare field. So yeah, I think they'd have a harder time understanding you if you try to say something in Finnish if it's not your language than if you say it in clear English.
So would you say all your like staff or colleagues that you work with would understand English if someone came in?
Yeah, we need to be prepared. We have patients that don't speak Finnish, and we need to be able to provide the same quality of care as anyone else.
Yeah, so if you're worried about coming to Finland and not being able to communicate like your emergency needs, like you shouldn't feel scared about that, because people will be able to understand you and get you help if you need it. And like even most, I guess it depends like where you are, but especially if you're like near Helsinki, even most pedestrians and stuff would be able to know English.
Yeah.
What happens if someone comes to your ward and they don't speak Finnish or English, like a patient?
We get them a translator.
How quick does that happen?
Pretty quick. We have phone translation possibilities, and also that like face-to-face where the translator comes to the ward and helps us. Also, we try to use the patient's family members if some of them speak Finnish or English, their friends, like all the possible options.
All right, so do you have any concluding statements about healthcare in Finland?
I mean, I think healthcare in Finland is quite high quality. There's still a lot of improvement to happen, and I'm only basing this on like what I've seen, for instance, in the UK.
Yeah, please
Like-
tell a bit about where you've worked, like what countries? UK and
I
Finland?
mean, yeah, but even in the UK, I was a student.
Mm-hmm.
Finland is very advanced with, I think, with the technology and like in its general data collection and staying like with the, what's it called, like the hygienic level.
Level of hygiene.
Yeah, like a lot of the stuff I've seen, for instance, in the UK, I would be like horrified, no, you can't do this, like this is an infection risk. For instance, this sound bad mouthing if I start saying like things and then people are gonna like hate on me. Okay, I'm just gonna point out something I found very curious is that, for instance, nurses and doctors in the UK wear their wedding rings or like engagement rings. And then in Finland that would be like, no, that's a clear violation of like hygiene. And then they like said that, oh, but it's like, it's allowed because it's a wedding ring. But I don't understand how sentimentality goes over like something as important as hygiene and like healthcare. Yeah, that's just something that really stuck out to me. I know Finland has a lot to improve, for instance, with mental health care. There are really long waiting lines, and like people who really need help with different mental health disabilities have to wait a long time, and it's time they don't have, and yeah.
So I remember that was also in the UK, unless you were like an immediate suicidal risk, like you could go half a year or longer on the wait list. Like even at the university, the waiting lists to see a university like mental health professional was like a month at least of waiting. Alright, well, I hope everyone thanks Heidi in the comments for joining us for this video. I couldn't have done it without her. My knowledge of the Finnish healthcare system is like this.
I mean, to be fair, I don't know that much either.
But
I don't even properly like full-time work in the field anymore, and I know things like change all the time, and
yeah, it's a dynamic field that like is constantly changing. But at least, you know, we were able to talk a bit about the basics, since that's something I lack knowledge in, so thank you for coming in and filling in
my pleasure
for information. If you want to ask Heidi any more questions or follow her on Instagram, I'll leave her handle or her username or whatever it's called like in the description. And yeah, everyone be nice to her, please. So yeah, I guess that just about concludes this video, so until next time.
Bye.